Hello, Denise. It's nice to see
Hi,
you again.
nice to see you too.
I see you've brought little Maya in with you today.
Yes, she's here whining right next to me in my arms.
And where's your husband, Glenn, right?
He's in the waiting room. He came with me, but I didn't want him to come in right now.
Okay, certainly. This meeting is for you. Um, I do think down the road it could be helpful to include Glenn once we've decided on some, you know, goals or plans or ways that you can start to feel better that he may want to be active with. But for now, I can see that Maya's feeding really well. So you saw the lactation consultant, and that,
Yep, that
yeah,
was good. She helped me. Yeah.
good, good. Before we really jump in, I just wanted to say I know I sent you home with a lot of papers
A lot of papers.
to fill
Yeah.
out, and yeah, and some of them may have been familiar from the obstetrician's office, and some may be new. I know we went over um, our confidentiality and informed consent
Mm-hmm.
last week a little bit, but I
Yep.
just wanted to quickly highlight a couple of things. I mean, we've talked about the fact that it's going to take a little while for us to continue to get to know each other and
Mm-hmm.
for you to tell me your story about your life.
Yeah.
But because you are right in this early time after having Maya, and it can be a time where women are vulnerable to having feelings of sadness
Mm-hmm.
and anxiety,
Yeah.
nervousness, and worry that can become overwhelming. It's really important that we focus on helping you to feel better and know where you're at with that today. But so that's going to be our immediate goal. Then our longer term goals will maybe be more about what happened with you yourself in your childhood, your relationships over time. I know that you have had definitely some more difficult relationships with the fathers of your other two girls.
Yeah. They're nothing like Glenn. He's the best.
I'm so glad to hear it. So the thing that is the most important, I think, for you to know is that there is confidentiality in this room. I would
Okay.
not talk with Glenn about stuff that you said to me. If you said that he was not the best, I would not be saying anything to him about that
Mm-hmm.
if
Good.
he could join us at another time. So this is private, it's confidential. There are only a few times when a therapist in my position is legally bound to share what happened in the therapy session. And
Mm-hmm.
that's really when I'm worried about your safety or safety of somebody else. So if I'm worried you're going to hurt or kill yourself, or do something to the little kids, and this would be true if it were, an elder person or
Okay.
a person who's disabled. But children in particular, of course, are vulnerable. And then how you're feeling about caring for yourself. Um, so we'll give you some crisis hotline numbers to always be able to call here. Um, we are here to help you, and we are going to help you not feel that way. Um, but you should know that if it came to it, that would be something I would have to do. Like, for example, if you had to go to the hospital because you
Yeah.
were suicidal, then that would be a time when let your records show. Otherwise, the
Mm-hmm.
only thing I was thinking is I would like to be able to talk to your obstetrician and your um, the nurse practitioner you're seeing for the kids, pediatrician. That
Mm-hmm.
like, it's always good to be able to have the family providers be able to be in communication. So down the road, we'll probably go through some different consents that are specific to that.
Okay.
Otherwise, pretty much the big thing that we had you do is called the Edinburgh Depression Scale, which is
Oh, yeah, I think I
know,
remember doing that.
probably done it. You've probably done it at your obstetrician's office.
Yeah, I think so.
Yeah, and this is just the best scale we've got to check in with our patients and our clients to find out how they're feeling while they're pregnant and in the months of, really a year after having your baby.
I'm
Um,
just feeling tired.
really tired.
Yeah.
And you also mentioned that it was hard for you to let Maya. go to Glenn like during this
Yeah,
appointment?
I don't like to let her go to anybody. I get these visions of her dropping me, dropping her, even just when I'm holding her or when I'm handing her over, it's even worse. I think I might just drop her and I don't know. It's just so scary and I just don't want to let her go.
And does this worry or thought become like the only thing you can think about in the moment?
No, not the only thing, but it's kind of always there in the back. I'm worrying and I just don't want to let her go. And she's up so much at night and I just don't sleep. And
Yes.
yeah,
So have you dropped her?
no, no.
So the thing is, babies fall, but when it's worrying you like that,
Hmm.
especially to the point where you're not able to have other people, like I know Glenn's mom is there a
Yeah,
lot too.
she is. And she really wants to hold
Out.
the baby.
Yep, and share that. Now, a lot of times, a lot of people want to hold the baby, and you do, as a mom, you're going to be protective, right?
Hmm.
But it does sound like this is a worry beyond what would be likely to happen, you know.
I,
So
I guess so.
why don't we work on that? There are ways we can do that. We can bring Glenn in maybe next time, and he can sit near you, and you could pass Maya to him then, and watch him get up and move around. Um,
Mm, yeah, that'd be hard.
sort of, and but you'll be in here, and we'll just do
Hmm.
a little bit at a time, you know.
Hmm.
And I think as you start to feel better too, and stronger, and get more sleep, some of these
Hmm.
stories will just start to fade. But I
I
do
hope
hear you.
so.
I do. How that can be really scary. When you have this vision of her possibly of you possibly dropping her, um, is it like you actually see a vision, that you're seeing something happening to Maya or to yourself, like it's happening in the moment in reality, but nobody else can see it?
No, no, it's not like that kind of vision. It's just kind of a thought that I keep having.
Okay. And do you have any thoughts where you're purposefully going to hurt her
No,
or any of
no,
the kids?
no, never, never. I would never hurt my babies.
And what about yourself?
No, I'm just tired. I just want to sleep. I don't want to hurt myself. I don't want to do anything.
And then sometimes we can feel like we want to sleep and never wake up. Do you ever get like a feeling of that?
Well, my babies need me. I couldn't
Yes, they
never wake up.
need you. They do need you. That's so important to recognize. So, in some ways, we would call that a protective factor. So, one of
Okay.
the other things that we're going to work with today or we may not have time to work on all of it today, but over the course of the next few weeks and several months, we're going to look at the pieces of your life that are protective and help you feel better and stronger and help you to feel calmer, um, help you to take care of yourself. So
Hmm.
um, the fact is the kids are that, and you've told me you're safe with Glenn. He doesn't hurt
Oh,
you,
yes.
doesn't hit you, he
Very safe
doesn't
with
yell at
Glenn.
you.
He's wonderful. Yeah, he
Yep.
really would like to do more for the baby. It's just so hard to let
So what
go
about at night? So he works as an electrician all day.
all day.
Yeah, but he's home pretty early, right? Like by dinner time.
Oh, yeah. Well,
Yeah.
by dinner time, yeah. He gets up early and leaves early, and then he gets home.
Yep. Right. And so one thing about the sleep, do you take a nap at all during the day?
If the baby sleeps, I try to sleep, but she doesn't really sleep. And
Yeah.
sometimes she sleeps in my arms. So,
Right. And then you can't quite fall asleep because you're
yeah.
holding her. So yeah. So well, why don't we look at how we can get you some more sleep? So one of the things would be, you're breastfeeding her solely. So
Yes.
do you have a pump that you can use?
No, I haven't had to so far. It's going well.
I'm very glad to hear that. And of course, that close bond that you have with Maya right now is so important. But it wouldn't break that bond to actually let her dad share in the responsibility and her grandmother share. And particularly at night, what can be really helpful about pumping is then you can have breast milk ready. And
Hmm.
then Glenn could actually get up when Maya cries.
Yeah, I never thought about that.
And then I know you're
Good
nervous.
idea.
Wouldn't he could go and get her and from the cot and bring her to like a chair right near the bed, and you can watch him with her. You can watch and you can give him suggestions, hold her up
Mm-hmm.
a little bit more, or now you have to burp her, all the things, right?
Mm-hmm.
You could do it together for a while.
Yeah, I could
Eventually
try
you'll
that.
see he'll be able to do it. Or at least while he's, doing it, you maybe could doze off, get a little rest.
Mm-hmm.
And also definitely during the day. We want to figure out a way, maybe Glenn's mom can come over for a couple of hours where you just go up and turn off the lights and take a good nap,
Mm-hmm.
eat sleep.
That
So
sounds great.
magnesium is a supplement vitamin that's safe for you and the baby, and you could try to take that. It's something called Calm, and it's
Okay.
something you can get on the at the Walgreens, or you know pretty much many stores carry it, and they have different versions, but it can be very helpful
Okay.
for sleep and that anxious feeling that you're having.
Mhm. I'm
And
gonna
also,
have to get going soon because Glenn has to get back to work.
yep, we've got to wrap up. So I did see that on that Edinburgh scoring scale, you
Mm-hmm.
did score 12, which is,
Mm-hmm.
borderline into or moderate worrisome symptoms for you, but you're still
Mm-hmm.
in the mild phase. And I'll tell you, there are so many women who have trouble with whether it's baby blues or depression or anxiety, or even these thoughts of maybe dropping her are not uncommon. So I've got some handouts for you to take home and take a look at, including those protective factors.
Okay.
We've got I've given you the hotline number
Yes, I have all those numbers in my phone.
in your phone, as
Yep.
we talked about. Great. And then when you come back in the next, we're going to meet again this week, and then
Okay.
we'll
That's
wait um, and do twice a week for now for the
that's
next
good.
few
Yeah.
weeks. Okay. And just to give you a chance to get really comfortable and feel like you've got someone checking in with you all the time. But so I'll give you this Edinburgh next time as well, and I'll be doing
Okay.
it regularly, and I'll probably add a regular depression screen and a regular anxiety screen too. I know that you may have seen these forms before as well. You'll try that magnesium calm. Remember,
Okay.
it's perfectly safe.
Mm-hmm. I'll try to remember.
And then, yeah, so we'll see each other next week. Glenn doesn't
Okay.
have to come in for the whole thing, but I would like you to try and let Maya be held by him
I'll
for
t
at least part of the time that we have
okay.
together. We can practice. If it's really hard, just work on it.
All right. That sounds great. I feel better. Thank you so much.
Do you have any particular questions? And if you
No.
think of them, because they definitely may still come up, you
Mm-hmm.
write through the portal. You can write, I would actually recommend keeping a little journal. So why don't you
Oh,
keep a
okay.
little journal and think about all the thoughts and questions you might have? We'll go over them next week, or
Okay.
excuse me, when we see each other at the end of the week.
Okay. Sounds good.
All
Thank
right.
you.
Take good care.
Thanks. Bye-bye.